Page 14, Clinical Therapeutics and Good Prescribing. Prescribing medicines is the major tool used by doctors to restore or preserve the health of patients. Medicines contain drugs, the specific chemical substances with pharmacological effects, either alone or in combination with additional drugs, in a formulation mixed with other ingredients. The beneficial effects of medicines must be weighted against their cost and potential adverse drug reactions and interactions. The latter two factors are sometimes caused by injurious prescribing decisions by prescribing errors. The modern prescriber must meet the challenges posed by the increasing number of drugs and formulations available, of indications for prescribing them, and the greater complexity of treatment regimens followed by individual patients. Polypharmacy, a particular challenge in the aging population. The purpose of this chapter is to elaborate on the principles and practice that underpin good prescribing. Box 2.1. Box 2.1, Steps in Good Prescribing. Make a diagnosis. Consider factors that might influence the patient's response to therapy: age, concomitant drug therapy, renal and liver function, etc. Establish the therapeutic goal. Choose the therapeutic approach. Choose the drug and its formulation, the medicine. Choose the dose, route, and frequency. Choose the duration of therapy. Write an unambiguous prescription or medication order. Inform the patient about the treatment and its likely effects. Monitor treatment effects, both beneficial and harmful. Review or alter the prescription. Sturmer's asterisk these steps in particular take the patient's views into consideration to establish a therapeutic partnership that aims to achieve concordance based on shared decision making. Principles of clinical pharmacology. Prescribers need to understand what the drug does to the body, pharmacodynamics, and what the body does to the drug, pharmacokinetics. Figure 2.1. Although this chapter is focused on the most common drugs, which are synthetic small molecules, the same principles apply to the increasingly numerous biologic therapies, sometimes abbreviated to biologics, now in use, which include peptides, proteins, enzymes, and monoclonal antibodies. Pharmacodynamics. Drug targets and mechanisms of action. Modern drugs are usually discovered by screening compounds for activity, either to stimulate or to block the function of a specific molecular target, which is predicted to have a beneficial effect in a particular disease. Box 2.2. Other drugs have useful but less selective chemical properties, such as chelators, example for treatment of iron or copper overload; osmotic agents used as diuretics in cerebral edema; or general anesthetics that alter the biophysical properties of lipid membranes. The following characteristics of the interaction of drugs which with receptors illustrate some of the important determinants of the effects of drugs. Affinity describes the propensity for a drug to bind to a receptor and is related to the molecular fit and the strength of the chemical bond. Some drug receptor interactions are irreversible, either because the affinity is so strong or because the drug modifies the structure of its molecular target. Selectivity describes the propensity for a drug to bind to one target rather than another. Selectivity is a relative term, not to be confused with absolute specificity. It is common for drugs targeted at a particular subtype of receptor to exhibit some effects at other subtypes. Figure 2.1, Pharmacokinetics and Pharmacodynamics. Dosage regimen, plasma concentration, pharmacokinetics, time, concentration. What the body does to a drug. Monitoring, measure plasma drug concentration at the site of action, pharmacodynamics. Effects, concentration. Pharmacodynamics means what a drug does to the body, and pharmacokinetics means what the body does to a drug. Monitoring measure clinical effects, pharmacological effects. Figure 2.1, Pharmacokinetics and Pharmacodynamics. For example, beta adrenoreceptors can be subtyped on the basis of their responsiveness to the endogenous agonist noradrenaline, norepinephrine. The concentration of noradrenaline required to cause bronchodilation via beta 2 adrenoreceptors is 10 times higher than that required to cause tachycardia via beta 1 adrenoreceptors. Cardioselective beta adrenoreceptor antagonist beta blocker have anti-anginal effects on the heart, beta 1, but may still cause bronchospasm in the lung, beta 2, and are contraindicated for asthmatic patients. Agonists bind to a receptor to produce a conformational change that is coupled to a biological response. As agonist concentration increases, so does the proportion of receptors occupied, and hence the biological effect. Partial agonist activates the receptor but cannot produce a maximal signaling effect equivalent to that of a full agonist even when all available receptors are occupied. Antagonists bind to a receptor but do not produce the conformational change that initiates an intracellular signal. A competitive antagonist competes with endogenous agonist ligands to occupy receptor binding sites, with the resulting antagonism depending on the relative affinities and concentrations of the antagonist drug and endogenous agonist. Non-competitive antagonists inhibit the effect of an agonist by mechanisms other than direct competition for receptor binding with the agonist, example by affecting post-receptor signaling. Dose response relationships. Plotting the logarithm of drug dose against drug response typically produces a sigmoidal dose response curve. Figure 2.2. Progressive increases in a drug dose, which for most drugs is proportional to the plasma drug concentration, produce increasing response, but only within a relatively narrow range of dose. Further increases in dose beyond this range produce little extra effect. The following characteristics of the drug response are useful in comparing different drugs. Efficacy describes the extent to which a drug can produce a target specific response when all available receptors or binding sites are occupied. Example, Emax on the dose response curve. A full agonist can produce the maximum response of which the receptor is capable, while a partial agonist at the same receptor will have lower efficacy. Therapeutic efficacy describes the effect of the drug on a desired biological endpoint and can be used to compare drugs that act via different pharmacological mechanisms. Example, loop diuretics.